I want to start today by highlighting several critical developments on both the testing and treatment that will help us win our war against the coronavirus. On Friday, the FDA authorized a new test developed by Abbott Labs that delivers lightning-fast results in as little as 5 minutes. That's a whole new ballgame. I want to thank Abbott Labs for the incredible work they've done. They've been working round the clock. Normally, this approval process from the FDA would take 10 months and even longer, but we did it in 4 weeks. Abbott has stated that they will begin delivering 50,000 tests each day starting this week. And as you know, even before this development, we've been doing more tests than any other country anywhere in the world. It's one of the reasons that we have more cases than other countries, because we've been testing. It's also one of the reasons that we're just about the lowest in terms of mortality rate, because we've been doing more testing, so we have bigger numbers to look at. I want to also thank General Semonite of the Army Corps of Engineers and General Pavlovicek, who's here with us, who's going to say a few words in a little while. What the Army Corps of Engineers did along with FEMA in New York was incredible. They built 2,900 beds worth of hospital, an incredible hospital in the Javits Center, which I know well. And I just want to say that was unreal. They did it in less than 4 days. People have never seen anything like that. And it's an incredible, complex, top-of-the-line hospital. They did it so quickly. Everyone's trying to figure out how they did it, including me, and I was a good builder. But they did it very quickly, Mike, so we're very happy. So I want to thank Army Corps of Engineers, FEMA, the incredible job they have done. Now they're moving to other locations throughout the country where they already have people building hospitals. We're doing them in Louisiana and New Jersey, many other places. But these are incredible men and women, and they worked around the clock, and the people of New York are very happy. Governor Cuomo expressed his thanks, which we appreciate. But these are, nobody could have done a job like that. Most people have never seen anything like it. The deployment of rapid testing will vastly accelerate our ability to monitor, track, contain, and ultimately defeat the virus. We will defeat the virus. It will also allow us to test doctors, nurses, and other healthcare workers immediately and enable us to act quickly and aggressively to shut down the spread of the virus, so important in critical facilities like hospitals and nursing homes. And we will ensure that we can give cities and states the best information to guide local decision makers in making. I want to point out that the hydroxychloroquine is being administered to 1,100 people in New York, along with the Z-Pak, which is azithromycin. And it's very early yet. It started 2 days ago. But we will see what happens. I want to thank Stephen Hahn, who's a great doctor, left one of the best jobs in our country running an incredible hospital in Texas, and he's the head of the FDA, and Stephen got approval for that so fast. Let's see how it works. It may not, but we may have some incredible results. We're going to know soon. So it's being tested on 1,100 people in New York. The FDA is also allowing the emergency use of a blood-related therapy called convalescent plasma as an experimental treatment for seriously ill patients. This treatment involves taking blood plasma from patients who have already recovered from the virus. So they're recovered, they're strong, something was good in them that worked. And so we take the plasma from those people that have recovered so well, meaning their plasma is rich in antibodies against the virus, and transfusing it into sick patients very, very, very powerfully. So sick patients will be transfused with the blood taken to boost their immune system. We'll see what happens. And we're having some early results that are good, but we will see. And that's going, I think, very rapidly. Again, we got approvals and really very quick time. We're also looking at an approval for the sterilization of masks. I kept saying to myself, I'd see some of the masks are very complex. We're delivering millions, by the way, millions. But I kept saying, why aren't they able to use that mask a second, third, fourth time? And Mike DeWine, the great governor of Ohio, called me. They have a company that is in the final process of getting approval for the sterilization of masks. And in some cases, depending on the mask, some of these masks are very, very strong, very powerful, very strong material. They're able to sterilize the mask up to 20 times. So that's, I guess, like getting 20 masks. And so we worked on that. As soon as I heard from Mike today, I got involved, and the FDA is now involved, and we're trying to get a fast approval for the sterilization of masks. That would be a tremendous difference. It would be really helpful. While much of the research has to be done, we have a lot of research left to do. Obviously, this treatment on plasma has shown promising results in other countries. We're in communication with other countries, and very strong communications, and they're very reliant on us in just about all cases. We have the greatest people in the world. They're very, very anxious to find out how we're doing on our different things, whether it's a cure or whether it's really anything having to do with getting people better. We have some interesting things will be announced, I think, over the next few weeks, but we'll see what happens. They're being tested right now. The vaccines are moving along very rapidly. The vaccines are an answer, but I'd like to see if we could do something therapeutically so that we could take care of the people that are already sick. And we're working on that at a level that people would be amazed. These are incredible people. They don't stop. This method also has been used for more than a century, and that's the blood-related therapy, more than a century to fight off infectious diseases. So it's not unusual. Our level of complexity has changed, but it's a concept that's been used for a long time, including during the Spanish flu epidemic. And that was really a pandemic of proportions like, frankly, nobody's seen until what we're facing now. That was in 1918. You know what the result of that was? Probably from 75 to 100 million people were killed. And also other viruses like the one in this outbreak. This is a very tough one. This is a tough one because it spread so quickly, like nothing we've seen. It spread so easily, so quickly. We're unleashing every tool in our nation's vast arsenal. Economic, if you look, medical and scientific, military, homeland security is working very, very hard with all of them in order to vanquish the virus. As you know, every level of government, state, local, and federal, is working nonstop to obtain more personal protective equipment for frontline workers. We're delivering vast orders of this material. I'm going to ask a couple of the people here to join me that both make it and deliver it. Joining us today are the leaders of America's largest distributors of pharmaceuticals and medical equipment, including McKesson, Cardinal Health, Henry Schein, Owens & Minor, Medline, FedEx, and UPS. We just concluded a very productive meeting about ways to keep our supply chains and delivery systems moving at top speed. And maybe I'd like to just ask for a couple of minutes for Mike Kaufman to come up, and maybe Ed Paseka. Mike is with Cardinal, and Ed is Owen & Minor. But I appreciate, and if anybody else has anything, please come up. But if you could come up, Mike, for a second, and Ed for a second, just you could maybe say what you told me before when we had the meeting. Thank you.
Thank you, Mr. President, and thanks for your leadership on this. Because of that leadership, we have really seen the government agencies working with industry like no time before. We've seen HHS, FEMA, the CDC work incredibly effectively with all of the distributors, and all of the distributors working together for the good of the people. And all of us have been so focused on making sure that we take care of our customers, because our customers are the ones that are taking care of the patients every day, and we need to do everything we can to make things good for them. And so it's been great to see how well all these government agencies have been coordinating together with us.
Thank you very
Thank you.
much. Appreciate it.
Thank you, Mr. President. Let me first start by thanking the administration for all the support you have provided to the industry. You know, one of the things we did hear the challenge, and starting in January, we've ramped up our production in the Americas, including our facility in North Carolina, where we are now manufacturing an additional 40 to 50 million masks per month to get into the U.S. healthcare system. And we talked a little bit about this in the pre-meeting. One of the issues we're struggling with is the demand increase. You know, used an anecdotal example of one hospital in New York that traditionally uses roughly 10 to 20,000 masks a week are now using 200,000 to 300,000 masks a week. So you multiply that times the entire U.S., let alone the same demand outside of the U.S. That's part of the issue we're running into, is even with a significant ramp up in supply, you know, there's still that demand that is much greater than that supply. Thank you.
Very much. And I bring that up because when we discussed back in a room, we were in a conference room, very nice one actually, it's called the Cabinet Room. That statement was made that they've been delivering for years 10 to 20,000 masks. Okay, it's a New York hospital, it's packed all the time. How do you go from 10 to 20 to 300,000? 10 to 20,000 masks to 300,000, even though this is different. Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? How do you go from 10,000 to 300,000? And we have that in a lot of different places. So somebody should probably look into that, because I just don't see from a practical standpoint how that's possible to go from that to that. And we have that happening in numerous places. Not to that extent. That was the highest number I've heard. That's the highest number you've seen, I would imagine, right? But this man makes them and delivers them to a lot of hospitals. He knows the system better than anybody, and I think you were more surprised than I was when you saw that number, so thank you very much. I hope I didn't get any of your clients in trouble, but it could be that they are in trouble. So they have to look at that in New York. FEMA is working with these companies to launch Project Airbridge to expedite the movement of critical supplies from other countries to the United States. The first flight arrived at JFK Airport, New York this morning, filled with 80 tons of personal protective equipment, including 130,000 N95 respirators. Those are the ones that we were talking about before. 1.8 million face masks and gowns, 10.3 million gloves, and many other things. Millions and millions of different items. FEMA has scheduled 19 additional flights and is adding more daily. We hope to have about 50 flights. We're going to have, I think, including the one that came in today, we're up at 51 flights with these massive planes from the different companies that were so nice to be here today. Would you like to say something on behalf? Please come up. Thank you.
Thank you, Mr. President, for the incredible leadership. I will share with you that UPS is really proud to be part of this effort. Vice President Pence and I had the opportunity to speak before, and the way we're going to win this war is with great logistics, and UPS is going to be part of that effort. We have a big brown army, 495,000 UPSers across the country that are ready to deliver. We're bringing in the supplies from anywhere around the world as fast as we can so that they can serve the communities that need them most. We're proud to be partnering with the states as well, because we know that in partnership with those states, we can deliver what is needed everywhere. So thank you, Mr. President.
Thank you very much. Great
Thank
job
you.
you're doing. Please. Thank you very much.
Thank you, Mr. President. I would certainly like to echo my colleagues' comments that the collaboration amongst many of the government agencies and the private market, the distributors represented here today, has been incredible, has been increasing and ramping up over the past weeks. Today's first delivery of Operation Airbridge, I think, is the first evidence that it's working. The 51 flights you referenced, we're excited about. We look to build upon that. So I would echo my thanks for your leadership, and certainly to the staffs for the terrific partnership and the commitment to protect the people we think about most often, which are the people on the front lines providing care. And maybe just a quick word of thanks on behalf of all the CEOs here to our teams that continue to show up in warehouses across the country, in pharmacies across the country, and do their jobs to keep the supply chain going. The supply chain is working, it's resilient, supply is a challenge, we're tackling that.
Thank you very much. Great job.
Thank you. Thank you, Mr. President, and thanks to FEMA and HHS. I think great leadership and is really working well. The demand has skyrocketed, and we're doing a lot of things to bring in more masks, more other protective apparel. We are involved in reprocessing masks, and we've already started at about 100,000 masks per day, and we hope to expand from there. So we're quite optimistic
Great
about
job.
it.
Yeah.
Thank you.
Fantastic job. Anybody else, if you want? Yes, please. You're doing such a great job. We have to let
thanks.
everybody if they want.
Thank you. Thank you, Mr. President. We appreciate the opportunity to work with your administration on a lot of collaborative fronts. Number one, we've all talked about PE products. That's critical, and it's not just to the hospitals. That's a must, but it's really to all healthcare providers out there working on the front line. So our commitment is there to get it to the hotspots and get it to the care providers that are taking care of those patients. It's absolutely key. Second, we talked in there about buying in America and getting resources back here and manufacturing in America. That is critical, a lesson to be learned from where we are. And lastly, we're proud that we introduced a test. We need to get some more tests out there in a rapid form. We're excited about that. We've worked with your administration very closely in the FDA, and we're very grateful for that because it's a quick, rapid antibody test that needed as well. So we're really proud to work with your administration. All going well. Thanks so much.
Thank you. So thank you all very much and for the great job you're doing. It's really incredible, frankly. Many of the states are stocked up. Some of them don't admit it, but they have. We have sent just so many things to them, and including ventilators. You know, there's a question as to hoarding of ventilators. Some hospitals and independent hospitals and some hospital chains, as we call them, they are holding ventilators. They don't want to let them up. We need them for certain areas where there's big problems. We can't hold them if they think there might be a problem weeks down the road. So we've delivered a lot, and this group has been really fantastic. We want to thank you. And UPS and FedEx, in particular, you've gone absolutely out of your way, so we appreciate everything you've done and delivered. The federal government continues to mobilize every resource to make sure our frontline doctors and nurses have the equipment needed to save American lives. Yesterday, I visited Naval Station Norfolk as the USNS Comfort departed for New York 3 weeks ahead of schedule, fully loaded with 12 operating rooms, 1,000 hospital beds, and hundreds of the best doctors, nurses, and medical professionals anywhere in the United States Navy, anywhere, frankly, in the United States. It was an incredible thing to see. Most of you saw that on television as it was leaving. It left literally 3 weeks early. It was under maintenance, and they got the maintenance done very quickly. They worked round the clock, as many of the people have, and it was a great sight. Additionally, two of the country's largest health insurers, Humana and Cigna, are announcing that they will waive copays, which is a big deal for anybody that understands insurance. They don't waive copays too easily, but we've asked them to do it, and they've done it. Coinsurance and deductibles for the coronavirus treatments to help ease the financial burden on American families during this pandemic. So they're waiving copays, coinsurance, and deductibles. I don't think anyone's heard of that one. Have you heard of that one before? I haven't heard. I want to thank them. Great companies. Today I spoke with Wolfgang Puck. Wolfgang Puck is a great restaurateur, as you know, as is Jean-Georges and Thomas Keller and Daniel Ballou and other leaders in the restaurant business, which has been probably one of the hardest hit industries. I've directed my staff to use any and all authority available to give restaurants, bars, clubs incentives to stay open. You're going to lose all these restaurants, and they're not going to make it back. They have to get going. So what I'm doing is I'm going to tell Secretary Mnuchin and also our great Secretary of Labor, who you know very well, to immediately start looking into the restoring of the deductibility of meals and entertainment costs for corporations. That set the restaurant business back a lot when it was done originally and then done not so long ago. And we're going to go to deductibility so that companies can send people to restaurants. I think it'll have a tremendous impact and maybe keep them open. I mean, don't forget, some are closing right now, despite the fact that they could be open in the not too distant future. We expect that, but there are some that aren't going to be able to get open, and we want to make sure they do. So we're going to look at the restoring the deductibility of meals and entertainment costs for corporations so that corporations can send people to restaurants and take a deduction on it like they did in the old days. That was when restaurants were doing really well. The financial relief bill I signed on Friday provided historic relief for American workers and small businesses. It includes $350 billion in job restoration and retention. So if you look at job retention loans for small businesses, that's a big deal, with loan forgiveness available for businesses that continue paying the workers. So it's $350 billion. Job retention loans for small businesses with loan forgiveness available for businesses that continue paying workers. I mean, how about that? $300 billion in direct cash payments are being sent to every American citizen earning less than $99,000 per year, $3,400 for the typical family of four. So they'll be getting a check for $3,400 for the typical family of four. Approximately $250 billion in expanded unemployment benefits. Under this plan, the average worker who has lost his or her job will receive 100% of their salary for up to 4 full months. The bill provides for these unemployment checks to be delivered through the existing state unemployment systems, not us, state. And I was opposed to this method because many of the states have very antiquated computer systems that are 45 years old, and they're not prepared to handle this kind of distribution, this kind of money coming in so quickly. They're not set up for that, and I didn't want to do it, but our opponents wanted it, so we did it. And if they don't get their money fast, I'm going to ask that we convene the federal government, that we come back to Congress, and we'll do something where we take care of it, because we can take care of it very easily and quickly, and I said that. But a lot of these systems are so old and so antiquated at the state level that they're going to have the money, they're going to get the money very quickly, but they're not going to be able to distribute it. So remember what I said, and we will, if we have to, call Congress back or find some other way of delivery of the money. Throughout this great national struggle, the American people have embodied the unrivaled patriotism and willpower that has led America to conquer every challenge, every single one in our nation's history. More than 90% of Americans say they are staying home as much as possible, putting their lives, their careers, their educations, and their dreams on hold out of devotion to their fellow citizens and to their country. Social distancing, that's the way you win. These shared sacrifices are pulling our nation together like never before. Family bonds are strengthening. Neighbors are looking after neighbors. It's incredible. I'm seeing, you're seeing, everybody's seeing what's happening. Communities are rallying for the cause, and all divisions are fading away. The Americans of every background are uniting to help our nation in this hour of need. It's up to 151 countries. So when we say our nation and the world, when you think of it, 151 countries. Somebody said to me today that wasn't in this particular world, they didn't know that we had that many countries. 151 countries, that's something. And some are struggling at a level that nobody would have believed possible. If you look at Italy, if you look at France is having big problems. Spain is having incredible problems. Something we did very well is when we stopped the inflow from China at a very early level. That was a good thing to do, great thing to do. We would have had thousands and thousands of more deaths. And we also stopped the inflow from Europe at a very early level. But those things were very important, especially the initial one, because we had never done anything like it where we closed our borders to a country like that. The modeling put together by Dr. Birx and Dr. Fauci and our other top healthcare I mean, we have, and these people are amazing, the healthcare experts who in this country are the best in the world. They demonstrate that the mitigation measures we are putting in place may significantly reduce the number of new infections and ultimately the number of fatalities. I want the American people to know that your selfless, inspiring, and valiant efforts are saving countless lives. You are making the difference. The modeling estimates that the peak in death rate is likely to hit in 2 weeks. So, I'll say it again. The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines that our great Vice President holds up a lot. He's holding that up a lot. He believes in it so strongly. The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread. On Tuesday, we will be finalizing these plans and providing a summary of our findings, supporting data, and strategy to the American people. So we'll be having lots of meetings in between, but we'll be having a very important statement made on Tuesday, probably Tuesday evening, on all of the findings, all of the data, and the reasons we're doing things the way we're doing them. We can expect that by June 1st, we will be well on our way to recovery. We think by June 1st, a lot of great things will be happening. I want every citizen in our country to take heart and confidence in the fact that we have the best medical minds in the world tackling this disease. We have the best science, the best researchers, and the best talent anywhere working night and day to protect your family and loved ones and to overcome this pandemic. With the grace of God, we are rising to the occasion. We are proving that no darkness can overshadow the eternal light of American courage. We will win, and when we do, we will rebound with astonishing force and speed. We will be stronger than ever, and we will have learned so much where something like this can never hurt us to the extent it has, and the world. Again, in our present crisis, the strength of our people is our single most important asset, and together we will defeat this invisible curse, this invisible enemy, and rise to incredible new heights. So I just want to thank you all for being here.